Good evening, everyone. My name is Simran Chaudhary, and I welcome you all to ThinkPink Advancing Breast Cancer Treatment Through Innovation, a virtual podcast series for Breast Cancer Awareness Month, October 2024. In this series, we will explore groundbreaking advancements in breast cancer care, featuring insights from leading experts. And together, we will uncover how innovative therapies and technologies are transforming diagnosis and treatment, empowering individuals and communities to take charge of breast health. So let's think pink and shape the future for breast cancer care. And for the episode, we are excited to introduce Dr. Sandeep M. Bipte, a leading oncoplastic breast surgeon at Surya Hospital for our podcast series. Dr. Bipte specializes in both medical and surgical management of breast cancer and has received advanced training in intraoperative radiotherapy and in London. With over 500 to 600 breast surgeries performed annually, he is recognized for his expertise in diagnosing and treating benign and malignant diseases. Dr. Bipte is dedicated to advancing breast cancer care through innovative approaches, and we look forward for his valuable insights today. Welcome to our show, Dr. Bipte.
Thank you so much, Simran. I'm glad to be part of this ThinkPink series, and hopefully, we'll be delighted to throw some light on this breast cancer awareness month to this the audience, and it will be a worthwhile to watch them. Thank you.
Looking forward for the same, sir. And starting with, if you can give our audience a brief about what exactly is breast cancer. As we know, a lot of social media campaign is going on. A lot of celebrities or the people who is diagnosed with breast cancer are coming forward, and creating that awareness. But it's always better if we have an expert in our house.
Right. So let me thanks Surya Hospital to start with, and the audience for joining this series, to taking the initiative, because the small step joining the session will contribute a lot in a breast cancer awareness. So to begin with, everyone पूछते हैं कि सर breast cancer क्या है, right? So it's like a cancer of the breast, right? So breast is like a is an organ where the breast cancer is increasing rapidly today. It's like a tsunami, in 10 years back, if you think about breast cancer incidence, इतना नहीं था जितना ये last 10 साल में हो गया, right? क्यों ऐसा? What happened last 10 years, right? So because of the lifestyle changes, there are a lot of things happen in the living woods. So the things have changed, and the woman become a victim of this breast cancer. So the breast cancer is some hard lump in the breast gland, and it turned into mutation, and a mutation change into a cancer cell, right? And most common form of this cancer is a lump in the breast, जिसको हम ब्रेस्ट में गांठ बोलते हैं, ठीक है. बट हमें इसको डिस्टिंग्विश करना जरूरी होता है, क्योंकि सारी महिला को लगता है ये गांठ नॉर्मल गांठ है, राइट. तो वो डिस्टिंग्विश नहीं कर पाती कैंसर क्या है और बिनाइन क्या है. एंड दैट्स द होल रीजन देन व्हाई इंडियन वुमेन आर कमिंग इन वेरी एडवांस स्टेज, बिकॉज दे कैन नॉट डिफरेंशिएट, राइट. सो माय टेक होम फॉर दिस स्मॉल क्वेश्चन वुड बी, कोई भी लंबे ब्रेस्ट है अगर आप एग्जामिन करिए, एग्जामिन करके आप अगर आपको लगता है दिस इज अनयूजुअल, प्लीज गो एंड शो टू द डॉक्टर विच में हो ब्रेस्ट कैंसर, राइट.
Thank you so much for explaining in a very simple and layman's term, because it is very important so that our audience can connect and
Correct.
understand what exactly it is. And
Absolutely.
before it's too late, they connect with the doctor, and if anything is there,
Absolutely.
they get this treatment.
And Simran, this is a first step of treatment. When somebody talk about when you have cancer, what to treat, the first step is not surgery, not chemotherapy. Examine yourself. Diagnosing that is the first step of the treatment. Once you diagnose it, that's the first step. You have taken the initiative.
Yes, you said it right. And if a person has to understand what exactly it is, so what are the early signs and symptoms of breast cancer that women should be aware of, especially
Yes.
those with,
So, so
that might be overdue?
Yeah, Simran, this is a very, very important question, and I want to make every individual who's watching this series, please emphasize. I'm going to talk about a few symptoms and signs which every woman should know. When I say a doctor, even doctors are the blood patients, right? So I want to make every individual understand. So how this happened? So when you talk about breast cancer, there are the 5 or 6 signs which come in a priority, right? So the first most important thing is ब्रेस्ट में कोई भी हार्ड गार्ड होना, हार्ड गार्ड जिसको बोलते हैं पेनलेस लंग. सो पेनलेस लंग जहां दर्द नहीं है, राइट. सो अपने ब्रेस्ट में या आर्मपिट में, आर्मपिट यानी जो एरिया होता है, आर्मपिट जो एक्सिला बोलते हैं, आर्मपिट ब्रेस्ट के बाजू में, अगर ये एरिया में कुछ गांठ आती है, जो पेनलेस है and hard है. This is the first sign. We call it पेनलेस lump. Second sign is निपल डिस्चार्ज दैट टू ब्लड स्टेन. इफ यू नोटिस, जैसे कोई महिला के मेंसेस आते हैं 14 ईयर से लेके मेनोपॉज तक, राइट? तो ये सारे दरम्यान दी ब्रेस्ट ऑर्गन इज अंडर द इन्फ्लुएंस ऑफ हार्मोन. एंड आपने देखा होगा सारी महिलाओं को कभी व्हाइट डिस्चार्ज आता है, कभी ब्लैक आता है, कभी ग्रीन डिस्चार्ज. इट्स वेरी कॉमन बिकॉज दी ब्रेस्ट एक हार्मोन के अंडर में होती है. बट अगर ब्रेस्ट में से निपल में से ब्लड डिस्चार्ज आ रहा है, ब्लड स्टेन आ रहा है, then another sign of the breast cancer. The first was painless lump. Second is a blood stained nipple discharge. Sometimes the woman may not notice. जब उनको लगता है मेरे bra में inner armament में I can see the stain. That's another sign we can notice it, right? थर्ड थिंग इज निपल रिट्रैक्शन. और रिसेंट ऑनसेट, किसी महिला को लगता है कि मेरा एक निपल अंदर जा रहा है, एक बाहर है. सो क्यों जा रहा है ऐसे? देयर इज समथिंग व्हिच इज पुलिंग इनसाइड एंड दैट्स द रीजन, दैट्स द फर्स्ट साइन. वन शुड थिंक दैट यस दिस कुड बी अ साइन ऑफ द ब्रेस्ट कैंसर. इज द थर्ड साइन. Fourth is change in the size of the breast. You notice that when women take a bath, they notice the breast every day and they are aware of it. But sometimes they change in the size of breast because something is pulling inside. That's another sign of the breast cancer. And fifth, last one, there may not be lump, there may not be nipple discharge, but पूरी जो ब्रेस है, ब्रेस में स्वेलिंग आ जाता है. जैसे हम इसको बोलते हैं प्यूरी ऑरेंज अपीयरेंस. आपने ऑरेंज देखा है, ऑरेंज के छिलके पे डॉट 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 होते हैं, इसको प्यूरी ऑरेंज. So same appears on the breast and whole breast look like a orange. And Simran, that's an advance in a breast cancer stage 3, right? So these are the only 5 signs out of, if I take 100 cancer, 100 में से 95 cancer इसी स्टेप में आएंगे Simran. There might be a variant 5 to 2%, 2 to 3%, but out of 100, 95% cancer will fall in this category. So my humble request सभी महिला को है कि when you notice this symptom or somebody tell them this symptom about that, we need to alert. My radar goes on alert. Yes, I'm dealing with the breast cancer. These are the most common signs of the breast cancer.
And I think the signs and symptoms we just explained, these are not so, people are not so aware of all these symptoms. लोगों को
Absolutely.
लगता है कि maybe it's just a lump or some pain or something, and that's
So,
fine. Maybe that is,
yeah,
and that is
to interrupt you, Simran, इंडिया में जो सारी महिला होती है उनको लगता है ये दूध की गठान है. मेरी
हाँ.
मम्मी को भी थी, राइट? मेरे फ्रेंड को भी थी, बिकॉज दे आर नोटिसिंग थ्रू आउट द पीरियड्स, राइट, फ्रॉम द 14 years of age till the 45 years. So out of 100, 90% lumps are benign lumps, Simran, non-cancerous, but 10% could be a cancerous. To detect 10%, we have to examine all the women. So do not take light any. Please do examine. Please you meet an expert. That's the best way we can do it.
But thank you so much for explaining us all the symptoms. And like you said कि आज से 10 साल पहले ये cases कम थे हमारे country में, but आज के
Absolutely.
time पे वो कैसे बढ़ते जा रहे हैं. And a
So,
similar question on the difference you said 10 years prior and now. So
right.
can we explain the difference in breast cancer prevalence between urban and rural population in India, and what lifestyle factors contribute to these differences?
Absolutely. So, Simran, this is a very big question. We can keep talking till evening also. But in a nutshell, uh, अगर हम देखें जाए, there are two parts. One is rural part and one is urban part, where we stay like all metros, right? Like Bombay, Chennai, Madras. So these are the metro cities. अगर वहाँ देखा जाए, incidence of breast cancer 1 in a 30 women. Can you imagine 1 in 30 women? And when you talk about a countryside, a peripheral village side, right? Village side, this incidence is 1 in a 60 women, almost half, right? So what happened? Why this difference is about? Then the real culprit come the lifestyle, right? A lady in the Mumbai, the first thing, the lady in the Mumbai, she's always busy, right? If you say marriage age, so they had marriages around career is more important, 30, 35, the marriage started at 35. So peak level is gone. And then 35 के बाद में, no, I want to develop my career, I don't want child, right? 40 में they tried planning for kids, right? When the peak level gone and breast cancer incidence increases. Whereas a lady in the village by 25, by 2025 get married, they had 2 children, the risk is gone down. Number one. Number two, the food style. The lady in the Mumbai walks in the early morning, 5 o'clock start, job, profile. She never carries the food. She had junk food, cold drink, coffee, all this around. Whereas a lady in the village will have bhakri and bhaji, morning, evening. She'll have right time the food, right? Third thing, a lot of women in these metros have contraceptive pills. They want to avoid pregnancy. Versus in village, no lady will talk about contraceptive pills. The insulin is completely gone. Right. Fourth, The packed food, the amount of junk food we have compared to rural, zero, right? So
Yes.
there's no junk food at all, right? So these are another sign. And the amount of stress we have, the lifestyle we have, the lady in the village starts her own thing. And second thing, the food what we eat today, the food what we eat today in metros are completely contaminated. The packed food in terms of the ready-made food. So the instance of packed food, there are a lot of chemicals mixed in. It is called as preservative. And in village, there's nothing like that. They went to the village, get this vegetable coupling, and just get the atta and from chakki and finish this thing. Here we have packed foods. We have chapati keep in the freezer for 1 week, and we eat parathas, right? All the preservative. We make the two gravies, keep it for 2 days, and then eat like a typical US pattern. And all these things require preservative. आपको याद होगा मम्मी बचपन में अचार बनाती थी तो she used to put a lot of salt in that. So salt
Hmm.
acts as preservative एक साथ रहने के लिए, right? So over a period of time, the salt become nitric acid, become a carcinogen. So whatever we have preservative, they are nothing but a carcinogen over a long period of time. So Simran, we have to see there are n number of factors. We have to see every factor is responsible, and that's why the incidence is very different into two places. There are so many reasons we can talk, but these are the main thing we can see here. You tell me where is the pizza burger, where is the KFC, where is the Domino's in the rural area?
Yeah, yeah. All these are the ultra processed foods, and we all are.
And this could contribute so much of these diseases. This lead to obesity, and obesity leads to breast cancer. This is another way. Have you seen
Hmm.
any baby in the village is so fatty and thin? The versus in metros you have signed overweight women, right? Because of the junk food, because of the pattern of the food. It's not about that. The pattern of food what we eat. And less exercise. Out of 100, there might be 20% women are doing exercise, right? In village, all the women get early morning, take out the water from the well, drop to the school, the children walking, and then they do the farming work. So this also contribute the hormonal play because when you work more, your hormone remains stable.
Yes. And I think all these factors make a lot of difference, and that's why there's less cases of breast cancer as the kind of lifestyle they live. But in
Yes.
case some of the breast cancer is diagnosed in the rural area, so what are the key challenges faced by breast cancer patients in rural areas in terms of access to care, screening, and
So
treatment?
Yes, of course, as compared to there are advantage and disadvantage also. In an urban city, we have a lot of centers like a mammography center. For example, all good center we have, good hospital we have. For example, I'm talking about Surya Hospital. I'm sitting here. If somebody walking here, I can screen, I can get the ultrasound, I can get the mammogram, and we can treat at early stage. Versus in a rural area, the lady doesn't have challenge a screening. They never check themselves, right? If
Mm.
something happened, ignore. They thought that where the money will come from, how I'll go, how doctor will family, where the money will come from. So there are the challenges to reach to the tertiary center to get a treatment. So finance is very important. Second thing, the awareness is not there, and that leads to sometime in an advanced stage. Versus in a say for example, we have mammography here. A lady went for mammography, got the cancer of 1 centimeter. Same way in a rural area, this lady will ignore because she said, "Oh, I don't have trouble. I'll wait for some time." And by the time stage will become a stage three. So that's the real challenge. A finance and education is a lack of at rural place, which need to become an advanced case. In city, we have screening program, we have doctors. That's a double edge. The advantage we can detect cancer in early stage. And Simran, I'm saying you today, 10 years back, I was seeing cancer like around 4 5 centimeter. And today I can see cancer on mammography. The lady doesn't have any symptom. I sometimes when I examine जब उनको देखता हूँ तो मुझे पता नहीं चलता कैंसर है या नहीं है because they're normal. But when I see mammography, I can see the small shot of 8 millimeter, 5 millimeter cancer. So that's an advantage. That's an advantage. We are picking cancer early stage. So these are the two different scenarios in Simran.
And I think that is all in all because of the healthcare advancements, research, and the
Absolutely.
technologies we have. That is helping a lot. In Yes, we know all these kind of things are becoming very prevalent nowadays, but because of the medical advancements, we have all
Yes.
these things which can help us in early diagnosis, better treatment, and cure.
Absolutely. Today we have the cure rate gone to the in a stage one. When we talk about stage one, the cure rate is around 95% Simran. When it goes to stage three, it gone to 50%. So technology definitely has booked into treatment so that we can have better survival then.
Yes. And with the, if you're talking about treatment, we do have that options of immunotherapy, targeted therapy, and the personalized medicines, right? All these terms, all these uh, treatment options we have nowadays because of the medical advancements. So, what role does immunotherapy in modern breast cancer
Right.
treatment play?
So
And
before jumping to yes, so Simran, before jumping to the immunotherapy, मैं ऑडियो व्यूअर्स को कुछ बेसिक चीजें बताना चाहता हूँ कि बहुत इंपॉर्टेंट जिनको जानने के लिए कि पहले ऐसा था कि ब्रेस्ट कैंसर मतलब एक लेडी का ब्रेस्ट निकाल दो, सो ये
hmm,
मिथ है. द फैक्ट आउट ऑफ 100 आई कैन से 90% ब्रेस्ट इन ऑल वुमेन. नंबर वन, 90%, राइट, इफ डिड अर्ली. पहले के जमाने में एडवांस ट्यूमर था तो हमें टुडे वी हैव कीमोथेरेपी, हम कुछ छोटा करके छोटा सर्जरी कर सकते हैं.
hmm,
सेकेंड थिंग, जो टारगेट ट्रीटमेंट जो है, नया ट्रीटमेंट जो है, पहले के जमाने में ब्रेस्ट कैंसर पेशेंट 5-5 दिन में हॉस्पिटल रहते थे. टुडे सिमरन, माय पेशेंट एडमिट द मॉर्निंग, सर्जरी इवनिंग, दे विल गो होम इमीडिएटली. सो टुडे मैं इन लोगों को बोलता हूँ द ब्रेस्ट कैंसर सर्जरी इज अ 23 आवर सर्जरी. दैट्स अ चेंज हैज हैपेंड. आई हैव सीन इट, आई हैव सीन माय सेल्फ इन माय प्रैक्टिस, राइट. When the cancer happened, there are the treatment involved, right? क्या क्या ट्रीटमेंट हो सकती है? The most important सर्जरी, कीमोथेरेपी, रेडिएशन थेरेपी, ये सभी को मालूम है, right? But these are the time tested treatment last 40-50 years, right? But you rightly said, what are the new technologies? So new technology includes the immunotherapy. There's a very good word, immunotherapy. The newer surgeries has come up, right? Innovative drugs are available. So there are so many changes. मतलब खाली सर्जरी में जो चेंजेस थे हम तीनों इसमें डिस्कस करेंगे. जो सर्जरी में थे, पहले सारे पेशेंट की ब्रेस्ट निकालनी पड़ती थी. नाउ देयर इज अ टर्म कॉल्ड एज ऑन्कोप्लास्टिक ब्रेस्ट सर्जरीज. व्हाट डज इट मीन
yes.
बाय ऑन्कोप्लास्टिक? हम ब्रेस्ट निकालेंगे बट वो पेशेंट का ब्रेस्ट तभी बना देंगे टेबल पे. विल मेक दिस मैस्टेक्टोमी एंड टुडे वी डू की होल सर्जरी. फॉर छोटे से निप्पल के एरिया से हम वो फीमेल का ब्रेस्ट निकालते हैं. उसी टाइम हम एब्डोमेन से, पेट से या पीठ से कहीं से भी फ्लैप लेके, इम्प्लांट लेके, विल मेक द ब्रेस्ट सेम एज बिफोर. तो जब पेशेंट एनेस्थीसिया से बाहर आती है तो शी विल ऑलवेज से, ओ माय ब्रेस्ट इज सेव्ड, यू नो, द फर्स्ट इंप्रेशन. So these are innovative technique happen in surgery. It's called as surgeries. I'll not go in detail, but patient के लिए ये है कि ब्रेस्ट निकालनी पड़ी तो ब्रेस्ट बना भी सकते हैं immediately. That's good sign. In radiation, there was treatment called as cobalt. कि पेशेंट हमें पूछते थे कि डॉक्टर साहब वो लाइट देने से आदमी कोयला बन जाता है, काला पड़ जाता है, राइट? So these are the oldest technique, जो कोबाल्ट मशीन थी जिससे रेडिएशन में ब्लैक होता था. Today we have such a fantastic machine, Simran, you can't make out radiation. कितने सारे पेशेंट में समझता नहीं रेडिएशन हुआ या नहीं हुआ है. That's immensely good machines, the technology is there, right? So the radiation has changes. And third thing in chemotherapy. So सबसे जो महिला डरती थी कि मेरे बाल चले जाएंगे, right? Today we have machine called as Paxman machine या cooling cap machine. जो कीमो लगाते हैं उसमें वो कूलिंग कैप पहनते हैं. एंड वाइल कीमोथेरेपी, एंड आउट ऑफ 100, 50, 60, 70%, 30-40% विल नॉट हैव हेयर लॉस एज कंपेयर टू दी नॉर्मल हेयर लॉस. सो हम हेयर लॉस भी प्रिवेंट कर सकते हैं. थर्ड थिंग, देयर आर ड्रग्स लाइक कीमोथेरेपी. कुछ कुछ एडवांस कैंसर में हम ड्रग यूज करते हैं. ये कीमोथेरेपी नहीं है जिसको ये देने से पेशेंट की इम्यूनिटी बढ़ाती है और कैंसर को हम खुद डिस्ट्रॉय करते हैं, और जिसमें कोई साइड इफेक्ट नहीं होते, हेयर लॉस नहीं होता, नहीं होते हैं, राइट? सो दिस आर दी मॉडर्न ड्रग्स आर अवेलेबल जो पहले 10 साल नहीं थे, जो अभी इजीली अवेलेबल है. देयर आर कुछ टारगेट मेडिसिन जिसको हम टारगेटेड मेडिसिन बोलते हैं, and the cost has gone from 2 lakh to 20,000. Can you imagine? When I started my practice, this drugs was one drugs were costing 2 lakh rupees. Today, same drugs costing 20,000 rupees. So all the treatment are accessible to the patient, right? So there are, and today government has funded so many hospital. There are different yojnas, there are different scheme, and I'm glad to say that I annually I do at least 100 breast cancer free operation, free
Oh, that's great.
surgeries. So whosoever come, I never deny treatment because for me it was half an hour, and there are different ways. Hospitals, for example, if somebody wanted surgery, we'll do in a consistent rate, subsidized rate, right? But that will we have to do that. So मुझे ऐसा लगता नहीं कि किसी को ट्रीटमेंट अवेलेबल या accessible नहीं है. In fact, today the treatment is available to each and everyone, either from rural or urban area.
I think that's great. In terms of the service you are providing for the breast cancer patient is amazing, and
Thank
you
you so
mentioned
much.
it right. The government is doing great work. Lots of yojanas are there. Everything is there. So
Everything
yes, you are doing
just in
great work.
will, yeah.
Yeah, and if I have to ask the role of AI and technological advancements in the in the role of monitoring, treatment, and the screening, how does it playing the role?
So AI had recently come up in the treatment, right? So AI has make it will reduce the manpower. For example, if I cannot go to the rural place to screen a woman, if I have some device, right, for example, a screening device, if I send some health worker with the device to the periphery, they screen the all the movement and the image captured from their from machine. I can see here and I can make, oh, this lady is susceptible to the breast cancer. Call them, right? So mass screening is possible, right? Sitting from here, I can do that. Second thing, authenticity of report can be possible. Although AI will not replace the standard treatment, but it will help us to lead a standard treatment, right? So screening mammography is helpful. In terms of the technology, now we have robotic surgeries, right? So it's a precise AI guided, right? So we have surgery very precise. We have diagnostic. Diagnosing, for example, if the pathology is not available in the periphery for this thing, but somebody can make the slides and AI guided person can see in Mumbai and make, oh, this lady has breast cancer. So there are the AI guided tools are at every step in terms of surgery, chemo, radiation, everything. But ultimately, a man has to, or maybe human has to make, even though AI, a human has to make this interpretation, right? So it's a
Yes.
good to take the mass screening, advanced treatment, and definitely in future time it is going to be a boom in cancer treatment.
You said it right. We cannot eliminate the human involvement or the human role in this process, but yes, it is very beneficial for the mass screening you suggested, and I believe every woman at certain age in the organizations working or they're in the college or anywhere wherever
Right.
this is required, we should make use of this and let's get
Absolutely.
every woman screened for this breast cancer, and so that we can create as much as awareness as much as diagnosis possible and make the treatments easy and
Exactly.
less hassle free for them with the help of technology and AI.
Right, Simran.
Yeah. Lastly, Dr. Bipte, I would like to ask the advice for women. What advice would you like to give to women and their families about reducing the risk of breast cancer and navigating treatment options if diagnosed?
So Simran, this is very good questions to as a general population. What I can do to prevent breast cancer, right? So there are the factors this called as modifiable factor. Second is non-modifiable factor. Modify मतलब क्या है? हम उनको risk factor कम कर सकते हैं. अब
Hmm.
जो नहीं कर सकते वो क्या है? Being a female, we cannot change that, right? We have to accept it. Age, we cannot change that. The risk is always there, right? Race, we cannot change that. So let's forget about that. We cannot change. But modifiable, the risk factor. So most important thing is there are certain factors which increase the risk of breast cancer. Most common is alcohol. The alcohol is now is like a social thing in a public, right? The use in 10 years back was not this, but today the contribution by female alcohol consumption is much increases. So if you can cut down the alcohol consumption, the cigarette smoking, cigarette is an active and passive smoker, both are equally responsible. You
Yeah.
see, I go to the Bombay Hospital and other, and when I see the other colleges, like the different colleges, the young girl of 16, 15 years old, they just smoke outside, and that's a trend we notice how that. So parent have to take initiative, no smoking, right? Because when this girl will become 25, she already exposed to a lot of the cigarette smoking. So this is another factor. Third, the contraceptive pills, which is easily available, should be taken judiciously with the help of the doctor, right? Nowadays we see the ad of eye pill. Whosoever consume eye pill by own, it's extra hormone. They're going to add the disadvantage to the body. Fourth, do not ignore any lump in the breast, right? Do self breast examination. Very very simple. It doesn't cost you anything, right? You don't require mammography every time. Just do self examination. It's a very simple technique. I'll teach you before. So there are two groups. One is a प्रीमेनोपॉजल जिनके पीरियड्स चल रहे हैं. मेनोपॉज जिनके पीरियड्स बंद हो गए,
Hmm.
तो जिनके पीरियड्स चले उन्हें डे 1 2 3 4 5 लेट फिनिश द 5 days of period. On 6th day they do examine. Simple, putting the right hand on the left breast from 12 o'clock, 3 o'clock, 6 o'clock, 9 o'clock, and armpit. There are 4 steps. There are so many videos on YouTube. You can see that this examination has to be done every month. So by doing examination, and जिनकी periods बंद हो गए मेनोपॉज, उन्होंने कैलेंडर में डेट मार्क करना चाहिए 5th, 10th, whatever date, and periodically examine करना चाहिए. When you start examining for next 3 months or 6 months, I'm telling you, Simran, you will be the expert of your own breast, and you, oh, this was there last time. It's nothing very. Oh, this new guest come. Let's go to my doctor. That's the way. If you start moving, you can pick up the cancer at 1 centimeter than a 3 centimeter. So from stage one, stage three. So
Yes.
my humble request to all my the sister and mothers who are watching this, please do not ignore any lump, and let's be your doctor of your own health, rather than become this tumor become your own issue. So let's do self examination, and at least this is the one way we can easily diagnose at early stage. Simple.
Thank you so much, Dr. Sandeep Bipte. You helped us a lot in by by awareing public females about what exactly is breast cancer, how what it is, what are the signs and symptoms, treatment options available, and how they can prevent this, and the
Absolutely.
regular self help, regular checkups. That is very very important, and it matters a lot. And thank you so much for becoming another voice for creating this awareness on breast cancer. It
So
means a
thank,
lot.
thank you, Simran. My another small request to every individual who is watching this: don't keep this knowledge with you. Please pass on to one person, and you will find the difference in others' life. Thank you so much.
Thanks a lot. Thank you so much.
Namaste. Thanks. Bye.